cancer is autonomous growth of cells which is not under the control of normal body system. So it can arise in any part of the body, maybe from top to bottom, from brain to head and neck and thyroid and lungs and liver and kidney and you name it. Any organ can have this kind of an abnormal growth of cells which tend to grow at the site of origin, and the body is connected through blood vessels and through lymphatic channels. So they can spread to the adjoining lymph nodes or to the draining lymph nodes. For example, for the oral cavity, the cancer can spread to the nodes in the neck. For the breast, the cancer cells can spread to the axilla. For example, from the legs, can spread to the groin lymph nodes. So like that, the tumor can spread to the regional lymph nodes. And through the bloodstream, the cancer cells can spread into the lungs, liver, bones and brain, because the whole body is connected through bloodstream. Benign tumors are the ones which do not grow rapidly. They are very slow. I mean, you might have seen people in the society or in a circle who have small nodules on the skin which are like neurofibromas. They do not grow in size and therefore they are termed benign. But when it comes to malignant or cancer cells, they are the ones which locally increase in size, and as I've explained, they spread to the regional lymph nodes and to the distant parts of the body. So as explained, so if the tumor is confined to the site of origin, so we can take the example of breast. If it is only confined to the breast, it is stage 1. If it is going to the regional lymph nodes, that is the axillary lymph nodes, then it becomes stage 2 for the lay people. When it is spread to the distant organs such as lungs, liver, bones and brain, then that becomes stage 3 or the advanced stage. So like that you can make the staging for any cancer depending upon their tumor size, depending upon the nodal involvement and the distant organ involvement. So now coming to the cancer treatment part, there are mainly 3 ways cancer can be treated. One is operation, second is radiation, and third is chemotherapy. So if somebody's cancer is localized to one organ, then it can be removed. So that is called surgery or operation. So for people who have limited disease, which is potentially curable, so surgery is done. In order to consolidate that response, people give local radiation, which is again given to the site of the tumor and to the regional lymph nodes. So that is given through the linear accelerators and certain newer machines such as IMRT or IGRT, or even now we have CyberKnife. So radiation is the second modality of treatment. Now chemotherapy is given to patients who have advanced tumors or cancers, or patients where the disease has been removed and we want to prevent recurrence. So chemotherapy is use of chemicals which are cytotoxic. What I mean by cytotoxic is that they kill the cells. So the problem with chemotherapy is that it is acting on dividing cells. So dividing cells are present not only in the cancer growth, but they are also present in the normal parts of the body. For example, in the bone marrow. For example, the nails are growing. For example, the hair are growing. For example, the reproductive system. So therefore, chemotherapy is having a double effect. One is killing the tumor cells, but also temporarily having side effects on these 4 or 5 organs, such as hair loss, such as bone marrow suppression, such as mucositis, that is the oral ulcers or diarrhea, and there can be nail changes, and people or women and men can become sterile or infertile as a result of the side effect of chemotherapy on the sperms and on the ova, in the testes and in the ovaries. So as I said, there are 3, the treatment of cancer is multimodality, in which you have to incorporate operation, radiation and chemotherapy. So it is the staging